battle on the front lines of COVID-19, and it's with mental health. Healthcare workers now navigating these uncharted waters, but there is help available. 13 Action News reporter Austin Carter is live tonight outside of Mountain View Hospital. He spoke with a local doctor about just how stressful this crisis has been. Austin.
Yeah, Jackie, it sure has. And a local physician tells me that folks who are already working in intensive care units and emergency rooms can burn out rather quickly because of how intense and mentally taxing the job can be.
And the stress level for all of us in a hospital is very high.
Dr. Stacey McHale is an OBGYN physician and rotates through emergency rooms here in the Valley. She says those on the front lines of this pandemic are dealing with a lot. The shifts are already long, usually 12 hours, and often the stress can begin the second they start working.
They come in and their COVID positive patient is unstable the minute that they get to the hospital, and that they have to call families that they've never talked to before to ask them to come in and make some difficult decisions.
Adding to the stress, Dr. McHale says many healthcare workers also have to isolate themselves from their own loved ones to limit possible exposure.
Some in separate rooms of their house, some actually away from their families in hotels.
And the mental health of healthcare workers is getting new attention after the tragic loss of Dr. Lorna Breen. She was an ER doctor in New York City who had been treating coronavirus patients. She died by suicide.
It's heartbreaking to know that there are people on the front lines that have perished, not just from COVID-19, but because of the mental health issues that have come from it.
Dr. Breen's family tells the New York Times she had contracted the virus as well, but had recovered. This all the more reason, Dr. McHale says, frontline workers need to know about available mental health services that are out there.